Hi, Farmington. It's Kristen Sherlock. How are you? I am here with Michelle, and Michelle and I were talking a little bit earlier about her life experience and how she ended up here in Farmington and in the insurance industry, because sometimes life just kind of, you have to pivot and life changes on you, doesn't it?
Yes.
So how did we get here? You can either go with Farmington on that one or with insurance, whichever one you want.
Well, I'll start with Farmington. So I am from Washington State. My husband's from Cottonwood Heights, and we're like the odd ones out. Neither one of us are from Davis County because people from here love it.
Yeah, they do.
It's awesome. We have figured out how wonderful it is, so we've stayed.
You know the secret now.
Yes, we know the secret, but my husband is also, he does medical device sales. And so his territory when we were dating was Ogden down to Salt Lake. So he just thought Farmington's halfway.
Davis County makes sense then, doesn't it?
We'll settle in the middle. So we were dating then. So when we got married, I just moved into the townhome, and that's why we're here. But as far as insurance, my husband had a kidney transplant in 2017, and at the time we left the hospital, so typically you have to be 65 to get on Medicare. But when you have a kidney transplant or kidney failure, it qualifies you early for Medicare.
So you can be on Medicare before you're 65.
Yes.
I had no idea.
I had no idea
I thought
either.
it was just like Medicare and Medicaid.
Exactly. When we left the hospital, they said, you want Medicare, B and D. And I was like, are you sure you don't mean Medicaid? No, you want Medicare, B and D. And I'm like, what is B and D? What does that mean? I had no idea.
A whole bunch of new terminology, I bet.
All these letters.
As well as taking care of your husband who is now recovering.
Yes. And it was a very difficult recovery. So
I bet.
There was a lot. So I had no idea what we were doing. I didn't know anyone that worked in this industry. I didn't know who to talk to. So I just had to figure it out. But I left a lot of benefits on the table that we were eligible for because I had no idea that they were out there, which was a bummer. Yeah.
Yeah. So then, so you have to go through your trial by fire. You're learning everything.
Yeah, we figured out the best we can. We do it. We get through all these years. And then about 2 years ago, a friend of mine approached me. We were just chatting one day, and she said she's working. I said, what are you doing? She said, I've started in the insurance industry doing Medicare. And I was like, what? Like, there are people that do this? I want to do this.
You're like, I have a crash course in Medicare.
Yes. And so I decided I want to do that. So I talked to her. She got me started. I work with her.
Okay.
She's here in Farmington as well. There's a bunch of us. We call ourselves the Medicare moms. And we're just trying to help educate people on what their options are, what their benefits are, what they're eligible for, and help them navigate this because it can be really complex and confusing.
This sounds so confusing. I wish somebody would hold my hand on just even re-enrollment time period when things come along. What are some things that most of us don't know that we should know about your industry?
So two things that I think are really important is, first off, if you want to work with an agent, which I highly suggest you do, it doesn't cost you a dime.
It doesn't. You don't have to pay the agent.
The client does not have to pay the agent. As an insurance agent, I'm compensated 100% from the insurance company.
Oh, that's
whichever
fantastic.
one. And I'm an independent agent as well as all of us that I work with. So we're not biased to one company. We're not going to try to push United if Select Health is better for you, if they cover your drugs better. So we look at all the carriers, we look at your prescriptions, your doctors, and see who's covered the best, and that's who we go with. So that's the most important thing. It doesn't cost the client anything to work with an agent.
Well, I like that. It's kind of like how it's been with our buyers, too, lately with real estate.
Yeah.
So, okay.
Exactly.
Like an insurance broker.
Like my parents got on Medicare just last year, and I called them when I started doing this, let's review your plan. And they said, yeah, we sat down with the guy and he showed us everything. And I was like, well, who's your agent? And she said, we didn't use him. He left, and then we just went and did it on our own. And I was like, why did you do that? She's like, well, I figured we had to pay him. I'm like, no, you don't. He was probably so sad that he missed out. Anyways, so you don't have to pay your agent. We're here to help and educate, and it doesn't cost the
I
client
love that.
anything.
I had no idea. What else is something that I don't know?
So the other thing I would say is just to stay open-minded when you're looking at insurance, because some people, so there are two basic things. When you get on Medicare, you can either get a supplement plan with your Medicare or an Advantage plan.
Okay, what's the difference between the supplemental and the Advantage?
So basically, when you go on Medicare Part A and B, that covers you at 80%.
Okay.
You're left with a 20% gap.
Okay.
So to cover that gap, people will either do a supplement plan or an Advantage.
Okay.
Supplement costs you monthly. It's
Okay.
like our typical insurance. You pay monthly and then you're fully covered. It's really great for some people. If they are, if they have a lot more health issues, or if they know they have hospital stays every year, it can be a good option, but it gets very expensive. It goes up every year. Then you have to add your prescription drug coverage on top of it, and that goes up every year too. So it just gets really expensive. Then on the flip side, there's what's called an Advantage plan.
Okay, so tell me about Advantage.
So that one combines your A, B, and your D, which is your drug coverage, all into one.
Which is kind of what they were talking about to you in the hospital then.
Exactly. That's where the letters come from.
Okay. Now I'm understanding the alphabet.
So it gets confusing. Yes. So it combines everything together.
Okay.
And instead of paying up front every month, you only pay when you use it. So let's say one month you go into the hospital and you get checked in overnight, you have a copay of around $350 for that day.
Okay.
And then it's covered after that. So copays, but not monthly. So the plans themselves cost $0 monthly, but you have copays. That's kind of stay open-minded, because some people get so set on, I will only do a supplement, it's the only way to go, or only Advantage. Like, just stay open-minded, because there's benefits both ways, and it's just best to figure out what's best for you individually. And that's why it's helpful to work with an agent, because they can help you figure that out.
So are we just dealing with seniors, or are we dealing with anyone else, like veterans or federal employees or anything like that?
I'm so glad you asked. So VA and TRICARE for life and federal employees are all eligible for a very specific plan on Medicare. So they usually think they're fully covered with their coverage. But what they don't know is that they are eligible for additional coverage on one of these plans. It gives them dental coverage, vision, and hearing coverage. It can give them gym memberships, and over-the-counter quarterly benefit. There's all these benefits that...
So many things are being left on the table, like what you said earlier. You don't know that you're not getting benefits.
Yeah, and you don't
have them.
Exactly. Well, just because you don't even know they're there.
Oh my goodness.
And also, if they are one of those, they're eligible for a Part B premium reduction.
Okay.
So everyone has to pay for Part B. This year it's been $164 a month. It's going up by $10 next year.
Okay.
But they can get anywhere between $50 to $100 back per month on that Part B premium with one of these plans. It's amazing.
I think the phrase back in the 90s was, it's a no-brainer, right?
It seems like it. So people will always say, what's the catch? That sounds too good to be true.
Right.
And I just tell them, how many years did you work and contribute to Medicare?
Yeah.
On your paycheck, there's the
true.
Medicare. We all contribute to it every 2 weeks
You might as
for our
well
whole lives.
collect your
These
benefits.
are benefits that you're eligible for. You deserve them.
Wow.
Use them.
Okay, so when's the best time to do this? Like, when should people come talk to you?
So open enrollment starts Sunday. It's October 15th to December 7th. So technically Monday,
now.
because that's the weekend. So now. So get in touch with me or any agent. We can help you figure out. We can review the plan you're on. The plans do change every year, so it's really beneficial to just review and see if there's one that would work better for you.
Okay.
They change up how they cover drugs, so it's good to review your prescriptions and see if there's another company that's covering them better than last year.
Right, because there's also the name brands versus the no-name brands, and all these things that come into play.
Yeah, and they change their formularies every year, so it's just different every year. So it's really good to review.
Okay.
And just see what's best for you.
So we need to have people call you now, or do you prefer email? How do you want people to reach you?
Call me or text me. That's probably the easiest. I've always got my phone on me, so.
Love it. What's that number?
Okay, it's 801-913-7133.
71.
It's my personal cell phone, and
you're gonna get
I
her.
will help you.
Okay, and so the name of your company is?
So I work under a parent company called Retirement Health Solutions.
Retirement Health Solutions, and we're going to have the website below to be able to look at.
They're here in Farmington. They have an office over by Smith's on Shepherd Lane. So we can meet people there. I love to come into people's homes, so you don't even have to leave.
That's probably
I sit
more
down with
comfortable.
you. It's super comfortable. I just bring my computer. I can show you everything, and I can enroll you right there on my laptop. So it's a really easy process.
So easy.
Yeah.
So easy to save so much money.
Yes.
And to take care of ourselves better.
Yes.
What would be like the parting thoughts that you would want to leave with people? Something that they need to remember or that they should know?
Oh, that's a good question. Well, I'm just going to reiterate what I said before. Stay open-minded when you're looking at your Medicare options, and I think that's about just stay open-minded.
And get an agent.
For
Because
sure.
you
Get an
need,
agent.
you need
It's-
maybe someone to advocate for you.
For sure, yes. And honestly, you don't want to have to be calling in to 800 numbers and getting people that
On
you don't
hold for 20
understand,
minutes.
and you're on hold for 20 minutes. If you work with an agent, you have their cell phone. You can call them anytime. They help you navigate any issues that might come up.
Because you could probably help them even when it's not open enrollment.
Oh, yeah.
Because you can help
All year.
explain things. And
Yes. Yep. If you do have any health conditions that change, your agent, you'll want to tell them, because there are certain plans only work if you have diabetes or a heart condition.
Oh.
So if one of those comes up,
Good to
you have
know.
to tell your agent about it, because they can get you on a better plan that has more benefits because of those qualifying health conditions.
So good. I am so glad I met you.
Glad I met you too. This has been fun.
Oh, this is so good. And I think there are a lot of people in Farmington that can benefit from having a conversation with you, just to even go over what they already have to see if it's sufficient or if there's something that's lacking. So, Farmington, get to know Michelle. I think you're really going to like her. Oh, well, thank you so much for meeting with me, and thanks for doing interviews. I know these are awkward and everything,
That's
but
okay.
otherwise, if we don't do them, nobody's going to really know about
It's true.
all the great things that are available here and the awesome
we're just
people.
trying to get the word out and help educate people and navigate this.
Same.
Yeah.
Love it. All right. Well, on that note, okay, thanks, Farmington. Good to see you guys.
Thank you.
Bye, guys.